Here we go. Thank you, everybody. I'm glad to be able to present some of my thoughts about how to create templates in electronic medical records, even the dreaded ones. My name is Ryan Will. I'm an orthopedic surgeon with Olympia Orthopedic Associates in Olympia, Washington. I have no disclosures for this talk, but I do use Epic in my main hospital EMR, so a lot of this is sort of from that perspective. I think that there are some key points I want to take away in this about 15-minute session or so. I want to express that I think templates are going to save you time. So when I dictate any operative note, it's hard for me to do it in less than 10 minutes or so. And with a templated op note that's been refined for a little bit, you can get it down to 2 minutes. That saves you 8 minutes of time, which is doesn't seem like a lot, but if you do 4 surgeries in a day, that's almost a half hour you saved. I find that this works best for repetitive tasks and other parts of documentation, so you can kind of cheat ahead, and that there's a good chance that you already have these in your head. You just need to get them out. And so I want to describe sort of how you can make your first template, and then I want to express too that it's easier than you think. This is not as if you know how to do complex surgery or evaluate complex medical problems in general, you have what it takes to create templates. Here's some of the challenges, though, that could happen, is that you think that it's just going to take too much time to set up, or that it's not going to help me in my practice. My practice is so special, I can't possibly set this up, or that the EMR it makes it too hard, or maybe you just never even thought of doing it, even though it was even an option, or you just go, your default is, look, it's just easier for me to talk into the phone. Believe me, I've said all these things to me. I lied to myself for about 7 to 8 years before I didn't have a choice, and I had to start becoming more efficient, or I was going to drown in my clinical volume. I currently work in a level 3 trauma center and do a higher volume of cases, and so without these tips and tricks, it's really hard to keep ahead. So I want to kind of describe to you what some of my templates sort of look like. The first thing to express is that these can be anything you want it to be. It's whatever you want it to do. So this is a page shot of what my brief op note looks like. So I've got today's date. Those 3 asterisks in a row are called wildcards. So in Epic, you can use F2 to kind of scroll through there, and you can fill those in with free text pretty easily, but you don't have to click with your mouse. Anesthesia type fluids, what my plan is at the bottom. I've got my plan so that it's easy for those on my team to know what I think the patient should be doing. And then also at the bottom note, I've got a note dictated confirmation number, little stem. That's just a little nudge for me to if I do have to dictate a note, that that I'm prompted to do it then and not put it off till later. So these are ways you can use templates to help make it easier in your practice to make it easier in your practice to just be more efficient in general. What are some examples or uses? Here, these are what I use templates for, but there's lots of other options. I use operative notes, operative consults, non-operative consults, different rounding notes. I have a whole list of common implants that I use. You can use this for physical exam findings. If you want to document elbow range of motion, you should just type in the numbers as opposed to having to type in all the different types of range of motion every time, or what are wound dimensions, or what are routine findings that you do every time. I'll make stems for what, if a patient's on certain anticoagulation, what that looks like, or for informed consent for surgeries that what I've talked about and what I've discussed with them, have those as stems that I can just easily download into the note, or different phrases for wheelchairs or walkers. Those have to have specific verbiage, and if you can have those already saved, it makes your life a lot easier. Another thing that really helps are what are my perioperative preferences or requests. So for example, I can have a stem in my pre-op note that expresses all of the what bed I want to use, what position I want the patient in, do I want regional blocks, what kind, so that everyone on my team can know as easily as possible what they need to know to do their jobs. And then also just sort of annoying things. So I can write pilon fracture, for example, but in terms of billing, you need to document that it's an intra-articular distal tibia fracture involving the weight-bearing surface. Well, you can create a smart phrase that has pilon, and you can exchange it for the longer phrase I have there, and that just saves you a lot of time, and you can still be clear in your documentation. So it just really, really helps you from your day-to-day standpoint. One other point I would say is that if you have a smartphone and you've set up little stems or phrases that you've abbreviated, little shortcuts, this is just shortcuts. And so if you can use a smartphone, you can probably do this. So what I would stress is, I think a place that I started that I think is a good place to start is sort of starting with operative notes. These are pretty commonly can be repetitive kind of tasks. And if you're going to make your first one, you should pick something that's routine in your practice. I used a hemiarthroplasty, a partial hip replacement operative note. I do that quite commonly. So I went back and I reviewed. I did the first time about 4 to 5 to 6 of my operative notes and picked the one that best represents my practice. I then just used the copy and paste function and put it into the smart phrase editor in there. I can find my right and my lefts and put those in there, so I can just smart click through those and replace with a smart list item, add an antibiotic smart list, and then make it gender neutral. So basically I take all the phrases that say he or she and turn into the patient, and you can use a simple find function for that and exchange. And then what you'll do is you go through this every time, you can naturally edit it so it better reflects what your practice is. I do think that is important you don't want to necessarily copy other people's templates because you want to do this in your own voice. That's going to be the most helpful to you and your patients. You can also add post-operative plan or surgery assist phrases or whatever you need to do to optimize your notes over time. So this is what my partial hip replacement phrase note looks like. I can click through this in 2 minutes. I can have my whole note done. I can go back and modify it if I have to change, for example, the DVT plan because the patient's already on chronic anticoagulation. I can delete out the surgical assist responsibility if I do this case without a surgical assist. I can go through and if I've modified something, I can go back and add if I need to. I've got my implant there just to fill in the numbers. So I can do this in about two minutes, and it just makes it so much easier for my staff, for patient care, for the physical therapist, for the nurses on the floor. It makes it a lot easier for everybody. And I know this looks like a lot of work up front, but really you've already dictated this. You already do this the same way every time. Maybe it's not this, maybe it's a knee replacement, maybe it's an ankle fracture, maybe it's a wrist fracture case. Pick something that you do commonly and start with that, and you'll find that it becomes easier with time. So what are the benefits? Well, I save time each day by not dictating. If I have a day where I have, it's unusual to have 3 or 4 hip fracture cases in my practice, and I can document really efficiently. I can save time to then spend either seeing other patients, or I can use that to return pages or do other tasks that I need to do at that time. I feel like that I'm stealing time each time I use a template for an operative note or a consult, especially a non-operative consult. I've always found it really annoying that the non-operative proximal humerus consult, fracture consult, for example, that I would have to kind of just keep redoing that the same way every time, and it would take a long time to do that. It would take 25, 30 minutes to do that. Now I can get that down to a lot less time and still be very thorough in my documentation. It allows me be an internal checklist for myself so that I know that I have everything I want to. That allows me to communicate better with my team members, so with my anesthesia providers, with nursing staff, physical therapy staff. Really helps communicate with those other teams so that they know clearly what I think should be done, and they can act accordingly, or I can react to changes they have, and that you can continue to improve your templates over time. Once you do it once, that doesn't mean it's fixed. You can go back and edit it every time you use it until you sort of get it down to where you really, really like it. Or if you make a change in your practice, you just make a small change, go back in, edit it, and you'll have that moving forward. So it is really beneficial to your practice. Here are some examples of some documentation improvements. So this is a Lecranon bursitis consult note that I have, and that I've got a phrase there at the end in my assessment plan that where I'm able to cite a specific citation and why non-operative management is going to be selected rather than operative management. And so it's very clear to the teams that discuss it with me what the plan is going to be. At the bottom of the screen, you can see I have a list for description of osteoporosis documentation. This is important to document. As orthopedic surgeons, we take care of a lot of fragility fractures, and as a group, we tend not to document this well, but this is a dot phrase that I can have included in any of my geriatric fracture patients that is documented, and it can really kickstart this. And I think this is a pretty good one because I've noticed that the hospitalists in my hospital, some of them have just copied and pasted directly into their notes, and it's spreading kind of like a virus. So I think that's a helpful thing to at least start documenting that our patients have osteoporosis. Treatment is the whole discussion. We won't do that here today. Communication. When I first started in my current position, I was getting lots and lots of pages from the pre-op area about do I want a Foley catheter? What position is the patient going to be in? What table are we going to use? Are we going to do a block or not? And so that helped me to have a surgical positioning stem so that I have this in all of my operative consults and all of my H&Ps for patients who are presenting for surgery acutely, so that everybody knows ahead of time what the plan is going to be, and it means that we have better flow into the operating room, and it means that I get a lot fewer pages from the staff, and that patients know what I need to do. On the other side of the screen is my postoperative plan stem. Weak bearing status is noted immediately, the antibiotics that are needed, where I think the likely disposition of this patient is going to be, what the DVT prophylaxis plan is, and then also, once again, it's this nudge. I can't close the note until I click through all of these wildcards. So it is a prompt for me to either bail and delete it and come back later and dictate the note and promise myself I'll do it later, or just I got time now, let's do it right now and get it done if that's a case that I don't have a template for. So if you're here, listen to me talk about this, you're looking to get better and more efficient, and becoming more efficient is part of that process. And so if you make a template for your most frequent surgery, really gauge and see how you feel afterwards. I still get a tickle every time I use one of my surgical templates because it feels like I am just getting back tons of time. So if it's 8 minutes and I've done 75 partial hip replacements in a year, and I save an average of 8 minutes, that's many hours throughout the year that I've gotten back by just doing nothing more than that template. And each year you use it, it gets more and more time. And so what will happen is that as you start making these, you'll want to make more. And that, sort of like if you give a mouse a cookie, if you give a surgeon a template, you're going to want to make more. And so I am more than happy to share tips and tricks and even templates. If you want to find out more, please email me there below, and we can figure out how to connect through that. I want to say thank you very much for listening to me, and once again, please feel free to contact me. I'm very interested in kind of helping those around who are interested in getting better. So thank you very much, and have a great day.